today I'm going to talk to you about some of the research that I've conducted around healthcare laundry, but particularly around attitudes, opinions and knowledge of nurses and laundry. And this wasn't completed just by myself. We also had psychologists involved, educationalists and experts who could analyse the data around opinion and attitudes. So our research has shown, we've sent out multiple surveys, which I'll go into more depth as I talk, has shown that basically change in facilities are the biggest barrier to nurses or healthcare workers being able to follow laundry guidelines. So we may say, well, why is it so important that the healthcare workers need to follow these guidelines? We're told that they can domestically launder their uniforms and that it's okay to take them home and wear them home as long as we've got a coat over the top, the risk isn't there. However, I would like to argue that's maybe not the case, and that microorganisms sees textiles as a surface to colonise as much as they do any other surface. Obviously, these are porous, unlike a surface next to a bed or a door handle, for instance. But some research we did quite a few years ago now has shown that E. coli and Staphylococcus aureus, so this is your MRSA, this isn't the resistant strain we used, was able to survive on cotton and polyester for a number of days. So this has shown that, and we did it just on the fibres, and we used cotton and polyester because these were the most commonly used fibres in uniforms within the healthcare environment. So I think you can see there that E. coli survives quite well. It's the blue and the green line for up to 21 days. And the Staph aureus is a little bit lower. And the other interesting thing that we showed was that once that contaminated textile, which the bacteria is living on for days, touches other surfaces, it is able to transfer. So what are the current policies around healthcare laundering of uniforms? Basically, it's domestic laundering. The evidence shows that it has to be 60 degrees. Anything below 60 degrees doesn't remove the bacteria. And this is based on some literature reviews quite a few years ago, showing that the evidence is that it's safe enough to take home and domestically launder. So the other evidence that come out from the policy was washing at 30 degrees will remove most gram-positive microorganisms. And my worry with this is the word most. In my opinion, even having some there is an issue. And a 10-minute wash will remove all microorganisms at 60 degrees Celsius, which our research agrees with. If you wash your uniform at 60 degrees with detergent, you will remove all the microorganisms. But in a busy household with nurses that have limited number of uniforms, don't have turnaround times between shifts are tight, have got kids, they're looking after elderly parents, all the other things that go on, is a full 60-degree wash occurring all the time. And the other issue we have with that, washing machines nowadays have got lots of eco and rapid and all sorts of other buttons on it that you can press to have quicker cycles. And we're going to talk about this later this afternoon in one of the TSA presentations, but they're not reaching the temperatures they need to. So you're relying on nurses' behaviours or healthcare workers' behaviours as well as the machines functioning as they say they do. So back in 2015, we'd already done the research that showed bacteria was surviving on textiles. We showed a 40-degree wash, didn't remove them. We showed that there was variation in the 60-degree wash. But we wanted to understand what the nurses believed at the time and what their understanding of the policy was. So back in 2015, we just did a quick survey. We had about 250 nurses reply. We just asked some questions. We just wanted to get a feel for it. So as you can see here, there was quite well, it was 265 nurses. So there was quite a variation in the responses we got, but what you can see is a large proportion was still washing at 40 degrees, despite the laundry policy saying 60 degrees. And there was a number of reasons for this, and so we asked the question, well, if they work in an infectious ward, is their behaviour slightly different to that of those that work on a non-infectious ward because they see a difference in risk? And the data showed no, there was no real difference there. Most worryingly, there was a couple of people hand washing their uniforms. And the other thing we asked is do you launder with other items of clothing? Because the policy says you should launder the items on their own. Our research has shown at 40 degrees within the wash that bacteria can transfer from the laundry, from the uniform, on to cross-contaminate other items in that wash cycle. Okay, so washing at 40 degrees is not great. Washing with other items of clothing, again, is not good because you're basically just swishing the bacteria around the washing machine. And there was quite, as you can see, there was quite a large proportion of nurses that were washing their uniforms with other items of clothing. So we had this is in 2015, we had 47% of healthcare staff laundering below 60. They weren't changing between every shift. And in 2015, they said the reason for this was limited changing facilities, them being located a long way from where they were based on their wards. They weren't able to follow the policies because they didn't have enough uniforms and they didn't have anywhere to change. So this was in 2015. And again, this was just me as a microbiologist and my PhD student just putting a survey out there to see what was happening, so we could relate it to the microbiological data that we had from the lab. Then we fast forward 5 years and the world dramatically changed as coronavirus hit. And we thought, okay, here's another opportunity. Let's find out what's happening now, what the nurses' opinions are, what the barriers to them being able to follow these infection control procedures around laundry are. And rather than just putting a survey out with my expertise, we got psychologists, educationalists involved so that we were able to truly analyse and use some of those theories and models that we used amongst psychologists to understand what was happening. So we wanted to know about the behaviour of coronavirus during the laundry process and what the policy was. Because at the time, I actually had one of the industrial laundries phone me up and say, Katie, what shall I do with this laundry? It's the first patients who've had coronavirus on. I was like, I don't know. So we looked back through the literature. Was there anything out there on coronavirus, textiles, laundry? And of course there wasn't. We all know how the story goes. There just wasn't information, and all scientists were out there trying to gain as much knowledge as we can in a short period of time. So the Public Health England was, if possible, get the uniforms industrially washed. If not, take them home, launder them, change before you get in or immediately when you get into the home environment. But there was just a general lack of guidance. And the industrial launderers were thinking of moving their temperatures up to between 80 and 90 degrees Celsius, which there's an environmental and cost implication from doing that. So I worked with a very talented virologist, and we managed to create a model from a coronavirus called OC43, because our lab wasn't a biosafety level 3, so we couldn't take the SARS-CoV-2 in. And we started to study the stability on surfaces, particularly porous textile surfaces. And what we basically found was that the coronavirus was able to survive in polyester for up to 72 hours and that it was able to transfer to other surfaces. On cotton, it was a much shorter period. It was between 24 and 48 hours. But we're still talking about lengthy survival on a uniform, and we're still talking about nurses in the middle of the pandemic taking their uniforms home and wearing them in the car, wearing them into the home environment, which in itself was worrying. So we published that, and then we did this survey. So we did this survey twice, actually, through the pandemic. So we did it in 2020 and in 2021. So we did it at the peak, and then as we had more information. So in the first survey, we nearly had 1,300 nurses respond, and quickly. It was within days, people were worried. However, you can see a year later, the same survey went out, and the number of responses significantly reduced. And I think that reflects just the pattern of the pandemic, that knowledge, the feelings and behaviours that we had across that period of time. But we still wanted to understand, in terms of laundering, in terms of facilities provided, what were the issues around uniform changing. So still during the height of the pandemic, 86% of participants were laundering their uniforms domestically. So uniforms were not being industrially laundered. Those nurses who were in that pandemic were still having to take their uniforms home and launder them. However, the evidence to say that the nurses were confident, the healthcare workers were confident in washing their uniforms, and the knowledge they had actually increased since 2015. So there'd been some push on knowledge happening. But we still had 17% of the sampled, only of the sampled, so that 1,300 nurses laundering below 60 degrees Celsius. Now, the research that we did on the coronavirus actually showed that with detergent in a domestic washing machine, you could remove coronavirus at 40 degrees. So in itself, from a microbiological point of view, this wasn't particularly worrying, but we've got to remember that hospital-acquired infections were still out there, and they were still there. So we hadn't got rid of the bacteria just because the coronavirus has come, and sometimes I think that's forgotten a little bit. Healthcare workers and wearing uniforms can claim tax relief, but a lot of them didn't know that, which was unfortunate. But 68% stated it would be safer and more appropriate for their uniforms to be washed industrially. So the nurses didn't feel it was really their responsibility to go into the environment they were in, the facilities they were in, and have to take their uniforms home to launder them. And over 50% felt concern and anxiety around this, which I think you would expect, wouldn't you? I think that's quite... So here we've got the need for the facilities within that environment. So within the hospital environment, with the need for facilities here, we've got people requesting for more space in changing rooms, more changing rooms, showers even, more showers, for discrete changing areas. I'm going to show you some quotes, and basically they weren't able to change with same-sex only. They were having to do it in toilets. So there was a lot of that going on. It's time-consuming to get to the changing rooms. I think there isn't enough facilities available, and nurses or healthcare workers don't want to have to walk across, I don't know, a building to get to them. A need for gender separation. I don't even think that should be on there in this day and age. That should be a given, really, to have that sort of respect of a changing space for female and males. A break room, that doesn't really. Cleaner facilities. Feeling unsafe and unclean environments. So this is what was coming out of the qualitative data that we were gathering, that we've broken down into the themes. So the majority of nurses were wanting these facilities, and these were some of the concerns they had, and why there was a need for a change in changing facilities, but more changing facilities available. So these were some of the comments that we had from nurses, from the hospital-based nurses, so those that were working on site. So I'll just give you a second to take some of that in. And generally, this reflects some of the comments I showed you in the table before. But then we also have the community-based nurses who are going from home to home. They're having to travel in their cars in between seeing patients. And so this is a whole different area and different thoughts. What are the facilities around this to aid these types of employees? Because the ones on the hospital based, you can at least see, well, we can put an extra changing room, or we can make that male, we can make that female. But those that are out and about, it's a whole different ball game for them as well. And they were obviously concerned as well and wanted some thought around these facilities that they had for changing. So really, in conclusion, what we're saying here is there's limited changing facilities. The nurses would like the changing facilities, would utilise them. The ones they do have are not always fit for purpose. And what we used was this psychology model or theory called COM-B that looked at a whole range of factors that influence the behaviour and the attitudes of those nurses. And the main underpinning thing that came out, as I said, was the change in facilities and their ability to be able to follow those laundry procedures, which they felt they couldn't. So just some acknowledgements there. We had the psychology team, we had a few PhD students from De Montfort University, the NHS were involved, the Textile Services Association and JLA as well. So yeah, thank you.